Hi, welcome everyone to this Family Medical Coping Initiative webinar, the 4 questions you should ask during every healthcare encounter. And thanks so much for joining us. My name is Annie Banks, and I'm the clinical social worker on the FMCI multidisciplinary team. The Family Medical Coping Initiative, or FMCI, is a program through the Hale Family Center for Families at Boston Children's, and we're a multidisciplinary effort spearheaded by psychology, social work, and child life. And the program was developed to provide education to families and professionals about ways to enhance child and family coping with medical conditions and medical care. FMCI's variety of recorded presentations and coping resources are available on the FMCI section of the Boston Children's Hospital website. And here is a QR code with a link to that site. And we hope that you take a look. Thanks. And now I'm delighted to introduce our guests today, Fiorella Downey and Dr. Eva Gomez. Fiorella Downey is a certified child life specialist who has been working at Boston Children's Hospital for 13 years. And as a child life specialist with expertise in child development, Fio's role is to help patients and their families cope with all things medical. Fio's first language is Spanish, and she loves working with all kinds of families. And Dr. Eva Gomez serves as the Senior Director of the Nursing Career Lattice Program, Equity and Engagement for Nursing and Patient Care Operations at Boston Children's Hospital. In addition to this role, she is also co-director of the Global Health Nursing Fellowship, and she co-chairs the Hispanic Outreach, Latinos, Amigos, and Allies employee-led group. Eva specializes in education, and she is passionate about helping patients and families understand health information, communicate effectively with healthcare providers, and use that knowledge to achieve the best possible health outcomes. And now let me turn things over to our wonderful guests to talk about the 4 questions you should ask during every healthcare encounter. Thank you.
Hello, everyone, and welcome to our session today. We're so glad that you're here with us today. I'm Fiorella, and I'm here with Dr. Eva Gomez. We're very excited to be here today and discuss a very important topic, the 4 questions you should ask your healthcare provider during a medical visit.
Theo, thank you so much. I'm very excited to be here with you today to speak about this very important topic. So thank you so much for having me.
Of course. Eva, sometimes it can be very overwhelming to go to a doctor's office, an appointment, but taking a few minutes to prepare before the visit can make a big difference in helping us make the most out of the visit and accomplish some goals that we might have for a visit, right?
Yes, absolutely, we do. And I wanted to offer to everybody some really important recommendations that can help you prepare for that visit. So let's start by talking about keeping that medication list. We always hear about medications, and this is probably the first thing that you hear when you walk into your appointment. So if you can, whether you do it on a piece of paper, on a notebook, or you do it on your phone, make sure you keep that medication list always updated with the dosage, if you know them, of course, and how many times a day your child takes them. And I think this is really important, especially because medications change from visit to visit. And this is going to help everyone in the healthcare team keep up with what's happening, especially around the medications. And if you always have questions about writing them down, it's always good to look at that label. Make sure that you look at the label, get that dosage and the amount of times per day. The next thing I want to recommend is what happened since the last visit. So as you think about having this conversation with your healthcare provider, think about what happened since the last visit. Have there been some important things that have happened, some new things, some good things, especially as they relate to your child's healthcare needs? So really important to take note and think about those pieces. Next, think about the blood work or tests that were done since the last visit. Even if you don't remember what the results were, can you make a note of when they happened? And if you happen to write them down, have them available so that you can also bring them up with your clinician or healthcare provider when you have that conversation. And then, of course, always write down all your questions. I always like to talk about coming into the hospital can be so overwhelming, right? It could be an experience where maybe you're rushing through the parking lot, you're trying to get to the appointment, you couldn't find parking and traffic and everything. And when you're in that space trying to get to the appointment, it's a lot of, there are a lot of things that are going on in your mind. And having this little mini preparation before your appointment, whether, again, if you have it on your phone or if you have it in a little notebook, it can help, once again, ground you. It can bring you back to where you need to be and how to be ready for that appointment. So when you finally sit down with your healthcare provider, you have your little summary in front of you ready to go so you can have that conversation. So those are a few recommendations that I want to bring to everybody as you prepare for your healthcare appointment.
Thank you, Eva. That's so helpful. So what are those 4 questions that you think parents or caregivers should ask their healthcare providers when they go to the medical visit?
Absolutely, Fia. So there are really 4 important questions that you want to ask your healthcare provider. And once again, these are going to help you kind of frame that conversation. Sometimes conversations with your healthcare provider, maybe they're all over the place. Maybe you have a lot of questions, or maybe they want to talk to you about something. But if you write down these 4 questions, there's very good chance that you're going to walk away with something meaningful. So let's start with the first one. The first one is, what is the health concern we're talking about today? So if you already know, because you already gathered all the information and questions, you can always say, I really want to talk to you about this specific concern today, and bring up all the information and the notes that you have available. This can sort of set the stage for your conversation with your healthcare provider, right? It's gonna get your mind focused. It's gonna get them focused on where they need to be. So starting with that question can be very helpful. The next question is, what are the top 3 things I need to do when I leave today? So if you're able, try to make a note of them on your phone or a piece of paper. Writing that information down will take away the burden from you having to remember them later. And again, think about how you walked into that appointment. It was, you had a lot going on. Getting out of the appointment can also be very overwhelming, right? You may feel like a lot of information happened, but if you have those 3 things that you need to do, make sure you jot them down, and that way you don't have to think about remembering them when you get home. It's like, what did the doctor say to me? What did the nurse practitioner say to me? If the dosage of the medication is being changed, also make a note of it. Or if the healthcare provider is sending for labs, make note which ones they're sending you to, and also note when the next follow-up visit is going to be. So again, you have all those things like very clear, 3 things you need to do when you leave today. And the most important one is the next one. Can you tell me, why is this important? Or how can these things help my child's health? This is by far so critical, because by asking these questions, we actually get to have prioritize what things need to get done. Not understanding why something is important may lead us to making a choice that maybe, I'll do them, or maybe not at all. But understanding why this is critical, it could be a great value for your child's healthcare. Theo, I'll give you a perfect example. Many times when children have to prepare before surgery, they're offered, that they're actually given instructions that they need to shower with a special soap before surgery. And people hear that, right? It's like, oh yeah, we have to do the soap. But do we know why? And the why of that special soap is really important, which is that washing with that special soap can help the child prevent infections after surgery. It's a way of preventing infection. So asking your healthcare provider why is so important, because that kind of raises the flag in your brain. I'm like, oh, this is really important. We have to prioritize this, right? We have to get this done. And that's one key piece that sometimes we forget to ask us, well, why is this meaningful and important? So keep that in mind when the next time you meet with your healthcare provider. And the last but not least important question is, if I have a question, how do I get in touch with you or your team? And many people, many clinicians and many healthcare providers have different ways. Some clinicians may offer you that you can call the clinic directly. Sometimes you have to reach them through the patient portal. So either way, make a note of it and make sure you write it down. And that way, moving forward, if you have questions, how you can reach them, especially determining which questions are important and which questions can wait a little bit later. But that one thing I want to add for you that is so critical is about talking to the clinicians and repeating back this information after they've given you the instructions or the information that you need. Repeating it back to them is something that actually clinicians are known as teach back. And many times we encourage healthcare providers to do teach back with families. But the reality is that sometimes it may be too hectic and they forget. But if you can remember, say to the clinician, okay, so this is what we're talking about today. These are the top 3 things I need to do when I leave. And the reason why I need to do these top 3 things is because of this, this, and that. And if I have questions, I'm going to get a hold of you in thus and such way. So repeating back what you just heard is such an important thing. And the last item that I want to address before we continue is this. If there's something that didn't make sense to you, it's okay to ask questions. I want to emphasize this so much. Many times we feel a little embarrassed if a doctor or clinician says to us, nurse practitioner says to us, oh, using a word that is a medical word and perhaps you don't know the meaning of that word, or they explain it in a way that didn't quite make sense to you in your brain. It's okay to ask, can you repeat that back to me? Can you explain that to me? Or I didn't understand the meaning of that question. Because it's really always better to ask a clarifying question than to last through an entire conversation wondering if you could figure out what that unknown word means. So if nobody's ever said this to you before, I want to say it to you very loud and clear. It's okay to ask questions, especially when they said something that perhaps didn't make sense to you. That's the most important part about a healthcare encounter, that you don't walk away with something that's not clear in your mind.
Thank you so much, Eva. It's so true. Asking questions and repeating back everything that you were just told. So we had the appointment. So what are some things that we should do after leaving the appointment?
Absolutely. So it's really important to also, once you have that information, if you had the chance to jot it down, great, all the better for you. But I think it's really important that once you get home and everybody's settled down and they've had a time to kind of calm everything, sit down with your beverage of choice, a cup of tea or cup of coffee, and review all and reflect on your visit. If they gave you an after visit summary, it will be a perfect time to sit down and read over it. Make sure that everything that was said is noted on that paper. And if you have concerns or questions about what's written on it, it's really important that you kind of go through it and make sure, yep, everything lines up with what I remember hearing from my healthcare provider. Another strategy that you can use is to share everything you learned during the visit with somebody that's involved in the care of the child, like a significant other, a partner, or another caregiver. I think it's really helpful sometimes for many people to repeat back information as if they were teaching it themselves. So that sort of gets cemented in their brain. And I think it's also really important that if you can't remember anything, think about the 4 questions, right? Think about what you talked about today. Think about the things that you discussed and the 3 things that you needed to do when you walked out of that appointment. Also talk about why those things were important, and also talk about how you're going to get a hold of somebody. And just by doing the exercise of sharing it with somebody else can really make a difference in helping you remember everything that happened, sort of cemented in your brain, if you want to call it that. And then the last thing I want to add is that if you went to the appointment by yourself, again, once you've had that opportunity to review everything, it's, talk it over again with another person that is going to be like that person that can keep you updated and help you remember in the future. Sometimes people may go with appointments with somebody, and having a conversation afterwards can help bring that information back. Or like I said before, if you went by yourself, talk it over, teach it to somebody else. So those are some really valuable strategies that you can implement after you have had a visit with your child's healthcare provider, and help you remember and get ready for what the appointments you may have in the future.
Thank you, Eva. This is also helpful. I feel like we cover a lot of information today. So should we summarize it for our viewers?
Yes.
What are all the great things you taught us today?
Absolutely, Theo. So I'm going to bring up my slides again today to kind of go over a little bit of a summary here for you. So first, remember, before the visit, gather the information about what happened since the last visit. Keep that always front and center as you prepare to go. And during the visit, just ask the 4 questions. What concern are we talking about today? What are the 3 things that I need to do after I leave today? Number 3, why are these things important? And number 4, how do I get in touch with you and your team if I have questions? And then after the visit, set aside some time to think about what happened during the visit that day and take time to talk to another family member or caregiver to review the answers to the 4 questions. So hopefully these are very important pieces. I'm going to leave them up there for another second just so that you remember. And Fio, I don't know, what do you think?
Well, thank you, Eva. We hope that today's conversation was helpful and gave our viewers some good ideas for how to navigate those appointments. Thank you so much for joining.
All right. Thank you for having me. It's delightful. Everybody have a wonderful day.
You
Thank
too.
you both so much for this presentation today. It was really helpful.